Hello, and welcome to my presentation on menstrual cycle tracking and phase-specific programs to improve athletic performance of the varsity female athlete. In introducing my topic, I recognize and appreciate that the topic of the menstrual cycle can be uncomfortable for some. I encourage you to keep an open mind throughout my presentation and be willing to learn how a further understanding of female physiology can help you in your practice. With this being said, I'd like to start with an icebreaker activity. I invite you to raise all 5 fingers of one hand. Each time I read out a phrase or idea that applies to you, put one finger down. Are you female? Do you work with female athletes? Are you an athletic therapist or student AT? Do you have an interest in strength and conditioning? Is the overall health of athletes important to you? If any or all of these statements apply to you, I hope that you are beginning to form an idea of how learning about the menstrual cycle and athletic performance may be important to your practice. With a growing number of young women participating in varsity sport, there's a disconnect in the research of these athletes. Brunvels et al. Highlight the significant underrepresentation of women, including in sport and medical research studies. Ostrach and Bosch also highlight that mostly men are chosen as participants because their physiology remains fairly steady day to day. When women are included in studies, they typically have to be in the early stages of their cycle, when hormone levels are low, as not to interfere with the results of the study. Women compete and perform at high levels throughout all phases of the menstrual cycle, which further emphasizes the need for a better understanding of the menstrual cycle and athletic performance. In beginning my research of this topic, my thoughts of how this could be relative to the field of athletic therapy were if we as ATs could facilitate the tracking of our athletes' menstrual cycles, we could use this information to create and collaborate with S&C coaches to create menstrual phase specific programs which could lower the incidence of overtraining and injury and also empower athletes to have a more positive attitude surrounding their cycle. Narrowing down my research topic led me to my question: does strength training during the follicular phase of the menstrual cycle improve athletic performance in the varsity female athlete? To explore this question, we must first have an understanding of the menstrual cycle. The menstrual cycle is cyclical in nature. A regular cycle is defined as lasting 25 to 35 days and is divided into 4 phases: follicular, ovulation, luteal, and menstruation. Each phase is characterized by changes in estrogen and progesterone. The research indicates that estrogen may have a more anabolic effect, whereas progesterone may have a more catabolic effect. Therefore, timing of training based on hormone concentrations may affect adaptations. Current research uses various methods to track the menstrual cycle: blood tests to determine serum concentrations of estrogen and progesterone, ovulation urination sticks, and the calendar method of athletes reporting the days they experience their menstrual period. The highest quality studies used a combination of these methods, although there is currently no gold standard indicated for how to track the menstrual cycle. As we know, the majority of varsity athletes complete some type of training program in addition to practices and games that is supplementary to their sport. Most of these training programs aim to be sport-specific and geared towards improving athletic performance. Mata et al. Highlight strength training is needed to progress to increase power output and therefore athletic performance. Strength training also provides the ability to prevent injury. In their systematic review of best practices for preventing ACL injuries in female athletes, Petushek et al. Emphasize that a program that focuses on lower body strengthening and neuromuscular control is most effective in preventing these injuries. Which brings me finally to the research in strength training, specifically in the follicular phase. Most of the research I discovered was comparing the effects of strength training between the follicular and luteal phases. I decided to focus primarily on muscle strength through maximum contraction, muscle diameter, and resistance to fatigue. While both training programs in the follicular phase and luteal phase showed improvements between pre-training, studies conducted by Sung, Eben, and Pavali showed more significant increases in max contraction in the follicular phase, while studies by Romero and Fazil showed no differences between phases. In regards to muscle diameter, Fazil and Sung both found increased size in the follicular phase. Interestingly, the most pronounced finding in a lot of the studies was the resistance to fatigue in the follicular phase. This suggests that the follicular phase may be the ideal time to do high-intensity training. Although exciting findings, there are some limitations to the research. As I mentioned before, there is no mentioned gold standard for tracking the menstrual cycle. Also, participants in these studies had to have a regular menstrual cycle and period, and many of the studies excluded participants that were taking oral contraceptives. As well, some studies tested only the upper or lower body, making relevance to all sports difficult. From the research, it can be concluded that at this point, this strategy may be more applicable to elite athletes as opposed to varsity, because varsity are typically at an age of large oral contraception use. Athletic therapists can continue to consider sport-specific, individualized programs that meet the athlete's needs and incorporate this strategy if the athlete's open to it. And also just be open to building rapport and learning more about the female athlete experience. Further research should continue to improve on the methodology of how researchers are best able to track the menstrual cycle and test throughout all phases. As well, practitioners need to get comfortable and confident learning about athletes' menstrual cycles, period. Thank you for listening. I now welcome any questions you may have.